tips, usually I will just buy uninitiated tips because initiated tips they are more expensive than uninitiated tips. And how do you initiate the tips? We can either use articulating paper or you can use cork from the bottle, the alcohol bottle. And the red beam that we are looking over here is actually the aiming beam. It's not the laser itself. Because remember, laser is not visible to our naked eyes. So you just go and then you press the pedal and you just go in. And then stop and take out. You can see this coated in black. So that's your initiation. That's when you turn the tip into a hot knife and it will cut. So after you initiated the tips, then you press confirm. And for diode laser, you may notice the mode over here. So usually for those who are very experienced, we will choose continuous wave, meaning that the laser will be irradiated continuously without stopping. You could also choose other modes like CP. CP means pulse mode, meaning that it irradiate and then stop and irradiate, stop and irradiate. So for beginners, you may choose the CP, but for those who really experience and have cutting very smoothly, you can choose the continuous wave. And for diode laser, for all the soft tissue procedure, shouldn't be more than 1 watt. You can even do with 0.5 watt or 1 watt. If more than 1 watt, usually is too high, and you may have risk of burning or charring the tissue. And then you press ready. And the diode laser tip, actually you can bend it. And then you can do the procedure. So depending on the angulation, you can adjust it accordingly. And remember what I told you just now, you have to go slow to be able to cut fast. If you cut very fast, it's not going to cut that well. So let me demonstrate to you. If I'm going very fast, it will be like this. It's like not really cutting. But if I go slow, and you can see it's cutting very smoothly and very fast. Can you see the difference? So you have to go slow. The tendency, especially for the beginners, you will tend to want to go fast because we are so used with bursts and scalpel. So always remind yourself to go slow, go slow, go slow. And you can see there is no charring, there is no carbonization. So this is how it should be. So if you notice that there is too much burning, carbonization, maybe your watt is too high or you are too slow, you stay at the same place for a long period of time, that's why you will also burn the tissue. So for diode laser, actually is very simple because it's basically a heat knife. It's similar to knife, but it's like a heat knife. So hands-on wise, actually you just need to know this, you have to go slow. And then if you want to do depigmentation, you have to angulate a little bit because you want to cover broader surface area. So let's imagine if there are pigments over here and you have to use the side of the laser, the tip to cut, not to cut, but it's to like doing a painting. It's like painting the walls like that. So it's very smooth and light touch, and you remove the pigments. You can also use all tissue laser to remove the pigments, but it's slower compared to diode. So for depigmentation, I would recommend to use diode laser. for those who are doing gingivectomy, so you could do it this way, or when you want to make sure that the shape of the gingival contour, you have to angulate your razor tip as well. So imagine this is the tooth, the coronal portion, and this would be your gum. So you should cut in this way, angulate and cut like this. You shouldn't cut at the right angle. When you cut at the right angle, then the shape of the gum will be like a staircase. So we want it smooth, angulated, so it will be like this. If it's a lower teeth, then it should be like this. Can you guys follow? Right? And the rest is pretty much the same. So what I want to stress here will be to go slow. So later when you all go to the other side to practice on the meat, remind yourself to go slow, go slow, go slow. So the lecturers, Dr. Nina, they all will be around to guide you all, and the staff Chang Chua here also will be there to help to explain a little bit if you have any technical issue. So far, any question that you would like to ask? So for periodontics, pocket therapy, it's the same thing after initiation, and then when you want to remove the granulomatous tissue or the pocket lining, imagine this is the tooth and this is your pocket over here, and you start, let's say you have multiple teeth to do. So let's say this is central incisor tooth 1-1, and then this is tooth 1-2. So you always start from distal to mesial, then tooth 1-2 distal to mesial, and then tooth 1-3 distal to mesial, because we want to avoid the heat burning at the same place. And the motion should be go in and out, go in and out, go in, out, go in, out. That's the motion. So it will be like in. Let's say this is the pocket lining, so it will be go in and out, in, out, in, out, in. That's how you remove the pocket lining. So diode laser is the hands-on part is pretty simple. So you all can go to the next room to practice on the meat, and then you can have one batch will be staying here. I can explain a little bit on the all issue later. So I will pass the time to